conventional approach is saying, you have an inflammatory disease, we're going to suppress the inflammation. So it shuts down, locks down, and inhibits or blocks normal physiology to try to stop the process. Functional medicine says, why is that happening in the first place? So we deal with some of the questions that are not being asked, which is not how to shut down the inflammation, but why is the inflammation there in the first place? And the approach is really changing the triggers of illness, the fundamental causes, things like toxins, infections, allergens, stress, and poor diet, all of which are the drivers of chronic disease. And there's a methodology for doing that that's very specific to functional medicine. And it's not something that is embedded within the conventional medical approach, which really focuses on symptoms and identifying the name of the disease and trying to match the drug to the name instead of going back to understanding the drivers and the cause of the disease and working with reframing how biology works through providing the raw materials to create health and removing the impediments to health. So how does this affect how I treat the patient? How does functional medicine change the way I interact with the patient in a clinic in a real setting? And the way that's different from the way I was trained in conventional medicine is that I use a different set of tools that are based on treating the cause. So if diet is the cause of heart disease, I use diet to cure heart disease, not simply to prevent it, but to cure it or to reverse it. If diet is driving inflammation, I use diet to help reverse inflammation. For example, if someone has an autoimmune disease to gluten that shows up in their body as joint pain, I remove the gluten. If someone has a toxin that's driving their immune system or that's causing mitochondrial injury leading to brain dysfunction, I help their body remove the toxins through improving detoxification of the body. So I use the same concepts of science, but I reframe them in a way that helps me apply treatments to the cause rather than the symptom. Functional medicine is a medicine that helps you understand the cause of disease and apply the right tool at the right time for the right patient and the right dose.